the Rural Ontario Institute would like to acknowledge that our office in Guelph, Ontario, is located on ancestral land that has been inhabited by Indigenous peoples from the beginning. As settlers, we're grateful for the opportunity to meet and work here, and we thank all the generations of people who have taken care of this land for thousands of years. So just a little note about ROI. We are a charitable organization that delivers community development initiatives to promote economic growth and well-being in rural communities across Ontario. We support and vision thriving and vibrant communities by offering leadership programs. We have the Advanced Agricultural Leadership Program, also known as ALP, and many of you on the call this morning will be familiar with that program. We also deliver the Rural Changemakers Program, which is leadership development for rural youth ages 18 to 35. We connect and engage rural communities through projects, through events, through webinars. And the topic of today's webinar, we provide data, evidence, and analysis for decision makers. ROI has developed 2 data-driven tools to help with decision making, and today's webinar is focused on introducing our new Wellbeing dashboard. And with that, I'm very pleased to welcome and introduce Danielle Letang, ROI's Manager of Data Strategy. Danielle.
Thanks so much, Ellen. And first, I have to just start off by saying that the fire alarm is going off in my building. So I'm really sorry if you can hear that in the background. It's a bit of a disruption, but there's not much I can do about it. So thank you so much for being here. And thank you, Ellen. I am joining you here today from the lands that are now known as Toronto, which is covered by Treaty 13 with the Mississaugas of the Credit. I am thankful to live and work on this land, which is also home to many First Nations, Inuit, and Métis people. So this is the structure for today. And so we'll start by going over an overview of what the project is all about. I'll also provide a demonstration of the dashboard. We'll spend a few minutes near the end talking about how you can apply the indicators in your work. And we've also reserved some time at the end for questions and discussion. But if it ends up being that there aren't that many questions, then we may not need this whole hour. So we may be able to let you go a little bit early. So who are we? Well, we are a multidisciplinary team composed of people here at ROI, but also some external team members as well. So I've been with ROI for about 2.5 years, and we've been working on this project since then. We're happy to have a few external team members that have been hugely influential in developing this initiative. I'd like to thank in particular Stacey McDonald with the Ontario Trillium Foundation, Nelson Rogers, our expert consultant, and also Perry Dworczyk from the Ecological Footprint Initiative. And we have benefited really greatly from the thoughtful leadership of our steering committee members. They are made up of some of our funders, along with rural representatives from social service organizations, rural municipalities, the health sector, and the nonprofit sector as well. But of course, we also have to acknowledge the immense contribution of our data champions. So we've been working with this volunteer focus group to help us make sure that the dashboard is relevant and user-friendly. The volunteer champions have helped us choose indicators and data sources. And now that we've launched the dashboard, the champions will help us develop use cases and also raise awareness of this project. When we first started, we had around 6 champions, and now we have more than 20 representatives from all of the communities and organizations that are listed here. So we want to thank our champions so much for being so engaged. And even though it's just me up here today talking to you, this really has been a group effort, and it's been really amazing to work with all of these people. But what is this project? Well, it's actually really simple. We are just trying to improve access to information and evidence for local decision making. We are trying to use a standardized approach that can be tracked across time and also across jurisdictions. We have developed a dashboard that displays indicators of rural well-being. And now that the dashboard is launched, we'll focus on knowledge mobilization and community engagement. We're very grateful to our partners for funding this really important work, including the Ontario Trillium Foundation, the Ontario Ministry of Agriculture, Food and Agribusiness, the Ontario Ministry of Rural Affairs, along with the York University's Ecological Footprint Initiative, the Rural Ontario Municipal Association, and Eco Canada. So thank you so much to our partners. But how did we get here? Well, way back in 2022, our first big question was, what indicators would we use? And it just so happened that at that time, the CSA group had released a new standard that was intended specifically to help rural communities assess their well-being. So we decided to adopt this standard as the foundation for our system. So the standard sets out a set of around 120 indicators that are grouped into 7 broad categories. There is a focus on readily available data as much as possible, and it also provides common definitions and methods. So the next step for us was to work with our champions to do an assessment of each of the indicators. So we assessed the indicators for both relevance and data availability. And what we found was that there's pretty good data coverage for some of the more traditional socioeconomic indicators that are focused more on demographics, economics, and housing. So topics that you would typically find in the census or that would be readily available. But there were significant data gaps when it came to the other indicator categories. And the standard acknowledges that for many of these indicators, local data collection would be required. But since we know that most rural communities don't have capacity or resources for data analysis, we excluded a lot of those indicators from our set, unfortunately. We did keep some of them as sort of a parking lot or wish list, but they're not currently in the dashboard right now because we weren't able to find any community data for them. And so because this whole process resulted in some gaps, we did identify additional indicators or proxies that we can use in the meantime. So this is the result of our assessment process. We basically ended up with a list of 90 indicators, and we were able to find data for 60 of those indicators. So this visual here shows how the indicators that we do have data for are organized on the dashboard. So there are separate pages for each of the indicator categories. And then within each of the categories, the indicators are further broken down into themes to tell a more focused story about well-being. So this is what the sort of organization and structure looks like right now, but we are planning on reviewing the entire set once a year using metrics and analytics of dashboard usage. But we'll also be listening a lot to community user groups. And so if we hear that there are indicators that might not be relevant, then we might consider removing them. But if we also hear that there are gaps, then we'll be really responsive to those community needs. Okay, so how to use the dashboard? Well, before we get into the demonstration, I'm just going to let you know that we have developed a video user guide, which is available from our website, from a few different places on the website, actually. And it's a really great resource to help you get started. It's quite short. It's only about 6 minutes long, and it does have some narration, although it is muted right now. There are bookmarks in the video so that you can skip to different parts depending on your needs or your interests. Okay, and with that, we're going to get right into the live demonstration of the dashboard. And so we're going to start with the very basics. You can find this information on the Wellbeing part of ROI's website. And you'll notice right away that there's a navigation menu here on the left side, and there's also a navigation menu here from the top. So it's important to note this because once you look at some of the dashboard pages, the left side navigation menu will disappear, but you can always use the navigation menu at the top. So from here, you can either switch between different dashboard pages, or you can go back to the main website as well. So to look at the dashboard pages, just click on the dashboard page here, and now you can see all of the different indicator categories that are listed. It also gives you that sort of big systems map, which I just showed you from the slide deck, so that you know where to find the indicators that you might be interested in. So to view the dashboard pages, just click on the category name. So we're going to look at the health page. And just a quick note while this loads that these are all embedded Tableau dashboards. And so sometimes there's a bit of a wait as the page loads, but that's perfectly normal. Also, just wanted to note that we optimize these dashboards for viewing on desktop devices, ideally using a large screen. We did create mobile versions of the layouts, so you can look at it on your phone or on your tablet, but it will look and function differently. So we do recommend using a computer. So the landing page for each of the pages provides an overview of all of the indicators that are in each category. The landing pages have a map for spatial context and then a community comparison chart right here. So you can use this drop-down menu here to change what you're looking at in the map and in the chart beside it. Below this, you'll find a definition for the indicator that is being displayed along with the appropriate data source. Here we have some links for help if you need it. And then at the bottom of each page, there are two tables. One is the totals table for comparison, so that you can see the overall totals for First Nations, rural, and urban communities, and then for all of Ontario as well. These values do not change no matter which filters are selected to enable that comparison. And finally, at the bottom of each page, you'll find a community table. And so this table presents all of the indicator values for all of the communities that have been selected. And so it's important to note that the default selection is all communities in Ontario, but you can easily sort the list of communities by clicking on the column headers to see the minimum and maximum values. You can also sort things alphabetically. There's many different ways. But one of the easiest ways to filter out this list is to use the filters at the top, where you can narrow down the geography and the list of communities. So we always suggest starting with a region so that you can see your community's information alongside your neighbors. So in this case, let's say you were interested in looking at access to healthcare in the Algoma district. So you would just use the region filter. So first you uncheck all, then you choose your region, which are census divisions, then you click apply. And you may have to wait a moment for the dashboard to load, but once it does, you just have to click somewhere else on the dashboard to exit that filter menu screen. So once you've made a selection, you can see that the map has zoomed in and we can now see data for all of the communities that are within this region. You can then look at different indicators here if you want to change what you're looking at. And so if we want to look at the number of health facilities, for example, we can see right away that in this region, the number of health facilities is concentrated in just a couple of communities. If you scroll to the bottom, you can also see here that we have all of the community's information in this table, which again, you can sort by clicking on the column headers. Important to note that the overall total here is calculated automatically by the dashboard based on your geographic selection. But let's look at some details for this. So we'll go over to one of the theme pages. And so now we're looking at indicators for the number of health facilities and the different types of facilities, but this is for the region. So if you wanted to see this information for a community, you can just use the communities filter. And it's important to note that the filters only show relevant values. So once you've made a selection, the other filters only show what's possible. So here we're only looking at communities that are part of this region. So it's the same, you just uncheck all, you make your selection, and then you click somewhere else. And so now we're looking at the data and information just for this one community. And this makes it really easy for you to compare what's happening in your community to the broader overall trends and patterns. At any time, you can download images of the dashboard. So you can click this button down here and click PDF and then click download. So if you were going to an important meeting or you had a briefing, you could just print this PDF or save it and bring it along with you to the meeting. That's a really easy way to take the information with you. You can also download the data though, if you would like more information. And so you can do that by either clicking here on this download data button, or you can go back to the main page to look at the data files. So here we have individual download data files for each of the different indicator categories. Note that the files contain information for all communities in Ontario, except for First Nations communities. Each of the data files has a bit of a metadata section so that you can see the list of indicators that are included in each of the files, along with the appropriate data source. This page also has a link here to our open data license, which we encourage you to download and take a look at. And you can also look at our data sources as well. So here is a complete list of all of the data sources that we have used with links to each of them as well. And we just wanted to make a note about First Nations data here, which is that we are not showing data for individual First Nations communities in respect of their data sovereignty. So instead, we have aggregated all of that data together, and we do look forward to engaging with First Nations communities to talk about data sovereignty and how we can apply OCAP principles to this work. Okay, so now I want to just briefly go back to the dashboard to highlight some of our other non-census data sources. So I'm sure most people are aware of the kinds of information that you can find in the census, but we're really happy to report that we were able to find 9 data sources that are not census data. So here again on the health page, we worked with the Ontario Long-Term Care Association to get information around the number of long-term care spaces and the wait times for long-term care. So here you can get a big picture of what is going on in either a region or a community. And then for mental health, we worked with an organization called Connects Ontario to obtain data for how many calls are coming in to Connects Ontario, and then why people are calling or why healthcare professionals are calling. It's important to note that this is an example of sort of a proxy indicator. In this case, we would have liked to show mental health status from the Canadian Community Health Survey. However, those data are not available at a local level. And so this is the data that we're using in place of that. If that data ever did become available, though, we would be sure to include it. And now I'd like to show you some interesting data from the economics page. So we know that internet access is sometimes an issue in rural communities. So we obtained information from the Ontario Broadband Resource Hub around internet access so that we can see where people have access to high-speed internet and where they do not. And then for context, we also showed what some of the other internet speeds are that households might have if they don't have access to high-speed internet. We also sometimes include contextual information on these pages. And so in this case, we're showing where people were working to see, if there's any sort of relationship between high-speed internet access and whether or not people are able to work from home. On the environment page, we have a lot of really unique data sources here. We were actually really happy to work with York University's Ecological Footprint Initiative to develop Ecofootprint and biocapacity indicators. And this is really an exciting project that we worked on with them. So here we have 3 different indicators, like I said, for biocapacity and ecofootprint, but we're also showing balance. And so this looks a little bit complex because we're also showing a lot of contextual information here. But really, these are sustainability metrics that can help people understand the impact of resource consumption on the environment. So, we can think of eco-footprint as the demand for ecosystem services, and biocapacity is the supply. And then you can look at the different components of each of those ones. And I'll just draw your attention to this black bar here, which represents the amount of forest area that would be required to absorb carbon from greenhouse gas emissions. This is usually the largest component of ecological footprint, and it tells us that sometimes the most efficient way, or usually the most efficient way to reduce eco footprint is to actually reduce emissions. And here we have contextualized in the tables, we've contextualized these indicators with land area information as well as income, because these are some of the factors that influenced the ecological footprint and biocapacity calculations. For conservation, we obtained information from the Canadian Protected and Conserved Areas database, but also from Ontario GeoHub for provincially protected areas like provincial parks and the Greenbelt. And we were also really happy to work with the Canadian Centre for Climate Services to obtain information for climate change indicators. And so we think that this information will be helpful for communities to understand how the climate is changing and how they can adapt to the future and see what that looks like. The commuting data here is just census data. So anything that I'm not highlighting is because it is from the census primarily. And now we'll just take a quick look at the society dashboard where we have some really interesting data from an organization called Mass Culture. So they shared some data with us from their arts data platform. So we were able to include information in here about the number and types and revenue of charitable arts organizations. And then we've paired that with information from the open database of arts and culture facilities. And so here you get a sense of the contribution of the arts sector to the vibrancy of rural communities, but you can also see if there's opportunities to improve or support that sector better. I also should have mentioned that if you wanted a detailed breakdown of all of the different data sources and how they match up with the indicators, you can download our definitions file, which has all of that detailed information in it. You can also download a list of indicators. And this list shows you actually the status of all the indicators too. So it shows you whether an indicator is being used, whether we're seeking a data source or proxy for it, or whether it's under development. Okay, so that was a really high level overview of how to use and navigate the dashboard. And now we're just going to go back to the slide deck and talk a little bit about how you can actually apply this in your work. And so for us, it's really important to note that success of this product is based on whether or not people are able to use it. And so we're just going to take you through what we think a couple of examples of applications might be. At a very basic level, we're hoping that the dashboard helps people gain a better understanding of what's currently happening in their communities. So we're hoping that they can establish baselines, identify issues or priorities for change, and then find communities who are experiencing similar situations. And then hopefully people can transform that understanding into action. So you can develop a data-driven policy, program, or initiative. You can monitor that progress over time, and maybe you can share some stories and celebrate successes. But for example, we've heard that some of our champions will be using this dashboard to review their community safety and well-being plans. Some community groups might use this dashboard to develop a business case for a funding application. But also, if you're developing something like a vital signs report, this information could be a really great starting point since it provides a solid foundation of local evidence. But no matter where you're at in the decision-making process, we think this dashboard can help you. So if you're at the beginning stages, like I just mentioned, the dashboard can help you understand the current context and identify some issues that need to be addressed. If you're in the action phase, then you might use the dashboard to help you design a program. Part of that design might be establishing goals and targets and then monitoring progress against those goals and targets over time. And then finally, using the indicators to determine what worked well, what didn't work well, and where you might want to make some adjustments. Ideally, we hope this dashboard will help to reduce the amount of staff time and maybe also consultant costs that might be associated with really expensive or extensive studies and reports. But you can't make any data-driven decisions without first talking about data. So we are encouraging you to have data discussions with your colleagues. And yes, I know that for some people that might sound really boring, but like you just saw, our dashboard is really user-friendly, it's easy to use, and it's easy to understand. So we encourage you to sit down with your colleagues and take a look at the dashboard and then just talk about it. Talk about what you're seeing. We know what stands out, what's changing, what might be surprising you. Or on the other side, what numbers do you see that immediately make sense to you? So that local context is really important. And then you might also want to know, what stories can you tell with this information? And then hopefully you can work with your team to brainstorm some ideas for actions. And we can help you do some of this. We can provide custom reports to help with your decision-making process. The reports would include maps along with data visualizations and infographics. For example, the image here on this slide is an infographic summary that's part of a report we prepared for the Temiskaming Health Unit. Our website lists a few different reporting options, including what we're calling spotlight reports that feature cross-cutting indicators to tell sort of a focused story about important topics like social determinants of health or economic development, and also sustainability. And we would love to have a data discussion with you to talk about your data needs and see how the dashboard can help you. So what's next for us? Moving forward, we're focused on mobilizing knowledge and engaging with communities. So please let us know if you're interested in booking a session. We'll also be maintaining and updating the dashboard and researching new data sources, especially for indicators that are related to community safety, health, civic engagement, labor force, and environmental hazards. So if you're aware of any community level data source for these indicators, please reach out and let us know. And finally, like I mentioned, a primary area of focus for us will be engaging with First Nations communities. So we are currently actively seeking funding and partners to help us have meaningful conversations with First Nations communities about data sovereignty and how we can apply OCAP principles. And so our team has accomplished a lot over the last 2.5 or 3 years. We are a small but mighty team, but there's still a lot more work to be done. So this is my contact information here if you would like to reach out. We look forward to continually improving our tool and to engaging with you. And I want to thank you very much for your time today. And now I will be turning it over to Mel for questions.
That's great. Thank you, Danielle. So if you have any questions, please feel free to put them in the chat. Before we get to that, I'm going to launch a quick poll that you should see come up on your screen. If you don't mind taking a couple minutes to answer those questions, that would be appreciated.
Danielle, while the poll is underway, a question in the chat, is there a fee for customized reports?
Yes, there is a cost recovery fee associated with them, but because we're a nonprofit, they're quite a bit lower than what you might find, from a consulting company. And we're also really happy to work with people and determine what kind of reporting option might best suit their budget. Some communities might just want a 2-page infographic summary, and that would be a really low cost option that we could help develop with them.
There were a couple of questions as well about the original partners who worked on the project, the champions. I don't know if you can go back to that screen and share it again.
Sure. Oh. The data champions in particular?
Yes.
Yeah, so initially our group of data champions, like I said, was about 6 people. And so a lot of those people were people that worked with us on phase 1 of the project, which was when we developed our initial pilot version of the dashboard. And so what we did is we engaged with 4 rural communities at that time. So it was the town of Goderich, Tay Valley Township, and I'm sorry, I can't remember the others, but there were 4 communities at the beginning, if you recall, that we engaged with, and then that has grown quite a bit since then. But in terms of the funders initially were, I think, our government funder, the ministry, and then we brought on Trillium in phase 2, and as well as Eco Canada, and then York University as well.
Question, can the dashboard overlap data sources to determine high risk and vulnerable areas in a community?
Not at this time, but this is just sort of the first version. So we have been talking about possibly obtaining cross-tabulated data or combining variables in that way, but this is just the first iteration. And so we will look at maybe doing some of that more complex work in the future.
Are we able to share this with other provinces and territories? And thank you for your kind remarks. Such an excellent tool and resource.
Yeah, we can absolutely share this work. We're being really transparent. So we have published a report from the phase 1 work that we did already. We'll publish a report from phase 2 in the the end of this fiscal year. And because we used this national standard, this CSA group standard, there's no reason why this work couldn't be applied in other jurisdictions. In fact, we have had some interest in exploring that. So yeah, I think absolutely we would be happy to share our process and talk to anyone else who's interested in using this approach.
Question, does the individual income refer to median or average income?
It is median after-tax income, I believe.
Thanks, Carmen. Carmen is suggesting to check out the Northern Policy Institute overlay capacity. And we will, I believe, make this deck available. I'm thinking that's the case. So we'll be sending that. We can certainly send it to you upon request in a PDF format. Really appreciate. So Danielle, you will appreciate that lots of people are pretty enthusiastic about the tool. There's a lot of lovely comments in the chat. Thank you so much, everybody. And if you don't mind, I'll just read this one out loud. Pam saying, thank you so much. So as a Roma board member, I'm continually appreciative of the work of ROI. Thank you. Looking forward to the presentation it is a Roma hosted presentation on November the 13th. So we'll be sending out tweets about that, and information will be available on our website. We will be focusing on the Wellbeing dashboard as well as our Rural Housing Information System dashboard. So lots of data for you in rural Ontario and elsewhere, just to sort of make those critical decisions that you need to make around policy and planning and community development. Many thanks. Mel, I'm not sure if I've missed any of the questions.
No, I think you've got them all. There's just one about the PowerPoint recording, and yes, we will have that on the website and share a link to that to all those who registered for this webinar. And I think that was the only question. There's one more down there from Alicia.
Yeah, go ahead.
Alicia is asking, she's saying this is great. Looking forward to diving into the dashboard. Thank you for all your work. Oh, sorry, this is Crystal. Alicia is just above. She's saying, if there are data gaps that we see, is there a process to fill in those areas?
Yeah, absolutely. So we developed a data strategy for this project that outlines a process for how we will update our list of indicators and data sources. So to do that, we're planning on an annual review exercise, but sort of what we'll be doing behind the scenes is always researching new possible data sources. And sometimes that it might involve, us actually creating the data like we did with the Ecofootprint indicators. We currently have a proposal in to do some research and develop indicators for gender-based violence. And so, this is, as our capacity allows, we'll try to do more of that work. But I think there's also a lot of work going on out there that we're just not aware of. And so we'd be happy to have people just let us know if they come across something that we could possibly use, and then we will definitely consider using it.
Would you mind putting your contact page up again? So folks, if you—
And Ellen, were you able to address Karen's question about fees for use of the tool and clarifying that there are no fees to use the tool?
Right. Yeah, this is a freely available tool that's publicly available from our website. The only fee would be for the custom reports. That would be the only part that would cost anyone any money.
And related to the study for the gender-based violence it's in application, so we don't have a timeline for that data.
Yeah, and I think the submission we did was for a three-year funding, so it would be a 3-year project. So it wouldn't be something we would have anytime soon. It would obviously take time to create that data and those indicators.
Do we have a strategy to continue capturing stories of how the tool is utilized, adds value, and for evaluation, return on investment, and to support sustainability?
So that's a really good question. We are planning on developing use cases. And so we invite anyone who's possibly interested in using this dashboard and letting us know how they're using it. We want to develop a really easy to use template for the use cases so that it's an easy process for people to follow. And so the number of use cases and then the qualitative stories of use that people can share with us will be really helpful in allowing us to measure our success and our impact. Of course, we'll also have some quantitative information around, the number of dashboard views, the number of resource downloads, all of that good stuff. But we also want to really highlight the stories and make sure that those are also considered with the same weight as the numbers.
I think we're starting to sort of wind up. Again, so appreciate your attention to this new tool that we've developed here. Danielle, hats off to you for the hard work that you've done. You yourself have done, and then you've sort of gathered allies and supporters along the way. And so thank you to the steering committee who's probably here today, and the champions who've also been working on this all along. Again, we are absolutely open to feedback. We'd love it. Suggestions and new data sources. Always open to looking at those as well. I think with that, we can give you back part of your day. Again, thank you for joining us, and we're looking forward to hearing from you about the community wellbeing tool. So thanks so much, everyone. Have a great day.